know, it's a new start to the year,
Yep.
and we're excited about this to share some good information with you. We know the dangers of smoking, well documented now over the years, as the CDC estimates tobacco use is the leading cause of preventable death in the U.S.
Yeah, the Cleveland Clinic said there is a path for you to kick the habit. For more, welcome back to the show, Dr. Ashish Saraju, cardiologist from the Cleveland Clinic. Welcome. Good to see you.
Good to see both of you again.
Thank
Good
you.
to see you.
Are people coming in like, hey, I have a New Year's resolution, I want to stop, I want to do something to improve my health, especially when it comes to your heart?
Absolutely. The new year, we always see folks coming in and saying, they want to change their lifestyle. They've enjoyed themselves over the holidays, and now they want to, sort of click refresh on their health.
Yeah.
And certainly, quitting smoking is one of the most important things that we can do.
You guys, when you see patients with your patients that come in, do you see a major increase because you ask those questions? Are you a smoker?
Mm-hmm.
Do you consume alcohol? What's your lifestyle like? Is it sedentary? Is smoking, does that seem to be the common denominator of a lot of people's problems?
That's a great question. I think we're sort of biased in a cardiology clinic. We often see folks with heart diseases, and certainly among folks who have heart diseases, it's probably a higher incidence of smoking in my patients. Overall, though, what's reassuring is that rates of smoking have decreased in the U.S. over time, which is great, but folks still do smoke.
Mm-hmm.
And so trying to focus on helping people quit smoking remains, I think, one of our #1 priorities for heart disease prevention.
I think sometimes people just don't associate. I mean, obviously, we know there's a bad association, but it's just air, it's just smoke coming in. I breathe it out. It's no big deal. It doesn't get into my blood. It doesn't get into my heart because it's just in my lungs, and I just expel it out.
Yeah. No, I think, combustible cigarettes, right? Smoking cigarettes, you've got the nicotine in there, which can be addictive. Withdrawal from that can lead to all sorts of symptoms. Then, of course, you've got the things that are burning in there. Those are carcinogens.
Mm-hmm.
They can lead to heart disease, sudden cardiac death, cancer, things like COPD, chronic obstructive pulmonary disease. So it is not benign whatsoever.
Yeah, I mean, usually you would think of just the connection with lung cancer, but as you said, with all of these different heart situations.
That's right.
Let's talk about ways that, we're looking at some of the benefits of stopping smoking.
Yeah.
So you can see, and the great thing is when people feel like, I've been smoking for 40 years, what's going to happen now if I stop? But really, you see major improvements soon when people stop.
Absolutely. It's never too late to stop smoking. Okay, you're never too late. And quitting smoking can lead to, again, sequential improvement in your overall health.
Mm-hmm.
You may see changes in your blood pressure and your heart rate, the way you feel, the way you're breathing.
Mm-hmm.
Your breathing might get easier. Your heart disease risk goes down over time. So these are all really good benefits. So it's, again, never too late to smoke. There's never a situation where you say, well, I've been smoking for all this while.
Right, people, you hear people say the damage is already done, but that
Right.
is not the case.
No,
it's really, truly not the case.
Absolutely not.
It's not easy to quit, though.
Yeah.
I mean, because you talked about the nicotine and the addictive properties. So how do we encourage people to do so, and what can we do to help them maybe try it?
Yeah.
Because it is so hard.
No, great question. I think the first thing is when the motivation, I tell my patients, when the motivation hits you to quit, strike while the iron's hot. Go for it. Don't put that off, right? Second, know that quitting smoking is one of the hardest things people can do in their lives. You may not be successful the first time, the second time, or even the third time, but that's no reason to lose motivation. Know that it takes several attempts to quit. And then lean on a support system to help you quit. Set a target. Set a timeline, remove things that remind you of smoking from your environment, and then lean on the healthcare system. Lean on your physicians for replacement products or medications that can help you quit if that's what they need. Sometimes it takes a multi-considered effort, but don't lose hope and don't lose your motivation if you're not successful the first time.
That's all great advice because it can seem insurmountable and it is a true addiction. And so surrounding yourself with people who can support you, and as you said, there are great medications that are being evolved every single day to help people with all of that. Now, turning to vaping, that is not a safe alternative because we used to hear that, I'm stopping to smoke, so I'll start this up. But that's not so good either, we're finding over the years.
That's right. I would not look at vaping as like an acceptable replacement for the other nicotine replacement products that are approved to help quit smoking. Even with vaping, there's aerosol mist that's going through your lungs. Yeah. They can irritate your lung tissues. They can cause damage. And if they're flavored, they may appeal to younger generations, adolescents, and we don't want that. We don't want nicotine addiction being exposed to our younger generations. So again, I would be cautious around using vaping as a tool to quit combustible cigarette smoking.
All right, Doctor, thanks so much. You're going to be on New Day as well?
Yeah.
Talk a little bit more about this?
Yeah.
Excellent. We'll
Good
see you
information.
then.
And keep talking to your kids. Don't
Yeah.
ever let them start, because it's a tough habit to break, that's for sure.
Absolutely.
Good to see you.
Great to see
Thank you,
you.
Doctor. Good to see you. Happy New Year.
Happy New Year.